Come in.
Hey, good morning. My name is Mavis. How are you?
Good, how are you?
I'm going to be your nurse today. I'm going to be performing a neurological assessment. It's going to involve some touching, so I'll be touching you. Is that okay with you?
Yep.
All right, awesome. Let me go ahead and wash my hands, and I'll be right back, okay? So, would you tell me what's your name?
Maria.
All right. Okay, do you know where you are?
The clinic.
All right, awesome. And do you know who's the president?
Trump.
All right, awesome. So the patient is Alara Orienta ×3, and she has appropriate hygiene and appropriate of speech to her age. Okay, I'm gonna do your cranial nerves now. We're gonna first test your olfactory cranial nerve. So I'm gonna ask you to close your eyes and smell something for me, okay? Can you smell this? What it smells like?
Vanilla.
Very nice. And let's try something else. Can you test it? Smell this one for me?
Mint.
Very nice. So you can go ahead and open your eyes, and we're gonna try to test out now your optic nerve.
Okay.
So let's try this. Look it straight ahead. Very good. And one more time. Very nice. Very good. And one more time. Perfect. So your pupils are reactive. So let's see if they accommodate well. So if you can follow the pen line with your eyes, not your head, okay? Very nice. So now they're reactive to light and accommodation. So we're gonna go ahead and test your 6 cardinals. So if the same thing we did with the accommodation, I want you to follow the pen light with your eyes, not your head, okay?
Okay.
So. Very nice. So this the first thing. Then the next thing we're gonna do something called sharp or dull, which is to test your face sensations, okay? So I'm gonna ask you to close your eyes, and I'm gonna be touching your face, and I'm gonna be asking, what do you feel? Is this something dull or is this something sharp? Okay. Close your eyes for me, please.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Very nice. So the next thing we're gonna test the trigeminal nerve. So I'm gonna ask you to clench for me, and I'm gonna palpate your face, okay?
Okay.
Can you clench for me? Any good? All right, very nice. And I'm gonna ask you to put your lips together, and I'm gonna try to move them against resistance and see if you're able to keep them closed.
Okay.
Okay, let's see. Very nice. And the next thing we're gonna test your facial nerves. So I'm gonna ask you to close your eyes. Very nice. Smile. Show me your teeth. Very nice. Frown your face for me. Frown your eyebrows. And poof your cheek. Nice. Very nice. So the next thing we're gonna do is we're gonna test the acoustic cranial nerve, and I'm gonna whisper something, and I'm gonna ask you to see if you can hear it. Okay?
Okay.
So I'm gonna try it over here.
6.
Very nice. 7.
7.
Very good. And let's do it again.
Okay.
8.
8.
And one more time. 10.
10.
Very good. 7.
7.
5.
5.
Very good. So let's try your glossopharyngeal nerve. So can you swallow for me? Very good. And let's do something. Let me get the pen light. Can you open your mouth and say ah?
Ah.
Very nice. So with that, I was testing the glossopharyngeal nerve, but mostly the vagus nerve. And what I look at when I test the vagus nerve is make sure that the uvula rises and it's midline when you say ah, and it was. So the next thing I'm gonna check is cranial nerve 11, which is your spinal accessory nerve. And I'm gonna ask you to shrug your shoulders again, resistant, and also move your head. So can you shrug your shoulders for me? Very nice. And move your head. Very good. And this one? Very nice. So can you stick your tongue out? Move it to the side. Very nice. And to the other side. Very good. And that was the hypoglossal nerve. And let's have your reflexes. Let's test your triceps reflex. So I'm going to ask you to put your arm out. And I'm going to, let's see. Very good. And let me test the bicep. Very nice. And the brachial. Very good. And the Achilles. And the patellar. Very good. And let's do the plantar. So I'm gonna, very good. Okay, so let me test this side. Okay, very nice. And let's do this one. Okay, very good. And let's do this one. Very good. And let's do your patellar. Very good. And your Achilles. Your plantar. Very good. Okay. So the next thing we're going to do, I'm going to test your coordination. So I'm going to ask you to stand up for me, please. Okay. So I'm going to ask you to close your eyes and I'm going to try to move you, okay?
Okay.
Very good. And I'm going to ask you, can you lay down, please? So I'm going to ask you to take your feet and move it from your knee down and then up the same way. Very good. And try with your other feet. All right, very good. Can you sit for me? All right, good. So can you with your hand touch your nose and then my finger? Very good. Can you try with your other hand? All right, very nice. You want to have a seat here? Thank you so much. Now, I'm going to ask you to grip my fingers. Very good. That's very good strength there. Okay, so I'm going to test your coordination and your sensation. So the same thing we did in your face, I'm going to do it in your arms, your fingers, and your legs. Okay, so close your eyes for me. What do you feel?
Sharp. Dull. Sharp. Dull.
Okay.
Sharp. Dull. Sharp. Dull.
Okay, and let's do your legs.
Sharp. Dull. Sharp.
I think that's it. In this test, can I get you anything?
No.
All right, so here's your call light.
Thank you.
Call me if you need anything. Again, my name is Megan. It's been a pleasure meeting you today.
Okay. Thank you.